Welcome back, everyone. We have Dr. Corsetti here who works with Tulane. You guys are focusing on the North Shore now and bringing something unique and different there. Let's talk about that first.
Correct. So I'm Ralph Corsetti. I'm a surgical oncologist, breast surgeon. I've been predominantly a South Shore physician for the last 25 years, but recently joined back with Tulane where I was before Hurricane Katrina. We're bringing breast health services back to the North Shore for Tulane. As the medical director for the Tulane program, we've entitled it Tulane Doctors Breast Health. So we don't specifically call it a center or a program, and in that way it allows us to collaborate with some of the community partners in the region on the North Shore. And so we've had great collaboration so far. We've been there for a little more than a year. So we work collaboratively with some of the other entities, such as the Pontchartrain Cancer Center, Mary Bird Perkins. We're doing cases at Lakeview Regional Medical Center, Avala. And this way it gives the community regional facilities and private community doctors a sense of collaborative partnership with a university setting, so we can introduce some of our clinical trials and research to the North Shore community. So it's a great avenue for patients to be exposed to the full gambit of breast health and breast care.
That's truly amazing. And you have such a unique system over on the South Shore. So why focus on the North Shore now? Why do you find that important?
Just in Tulane's long-term goals for programmatic growth and outreach, the North Shore, they've had Lakeview Regional Medical Center there and been affiliated there for years. And so to expand cancer services is on the agenda for Tulane on the North Shore. It's a great community. It's a service that patients need up there. And working with great private doctors as we grow the Tulane footprint up there has really been a great experience for me the past year. I've really enjoyed it. And once I'm going to return to once I return part-time to the North Shore in less than a year, I'm also going to maintain a clinic and an operative day on the North Shore. It's been a great experience, and I intend to keep practicing up there.
That's amazing. And tell us why you want to work with these patients. What is it like? And then seeing them walking this stage, I'm sure it's special and different.
Right. As a surgical oncologist that specializes in breast cancer surgery, I enjoy taking care of the breast cancer patient because it's every patient's unique and different. There's so much research. The NIH funds more research for breast cancer than any other cancer. And so because of that, breast cancer is ahead of the curve on how we manage it in terms of biologically advanced treatments targeting certain receptors. So each case is uniquely different, and that's what I enjoy. I also enjoy seeing the great outcomes because of the advanced research dollars we have. The vast majority of patients do extremely well and are cured of their cancers and are long-term survivors. I really enjoy coming to this event because it brings me full circle from the very first time I see a patient. They're very anxious, obviously distraught about their cancer diagnosis, and it's hard for them, and it's hard for us, but certainly harder for them. But to see them come to this point where they're so happy and celebrating, the survivorship and accomplishment to reach the end goal, which is to feel whole again and back to normal.
That's really incredible. You offer such a great care for those patients who are in the darkness and feeling like they have nowhere else to go. And I'm sure that you're a great doctor and get to help with that. Is there anything else that you want to talk about now that you're adding services to the North Shore?
Just look for us, Tulane Doctors Breast Health. We're on the North Shore. We work with all the community settings. Like I said, we do surgeries at Lakeview Regional Medical Center, at Avala Hospital. We work collaboratively with the community doctors, the great radiation and medical oncologists through the Pontchartrain Cancer Center and Mary Bird Perkins and Tulane. And, of course, the great private community regional plastic surgeons that we all know. And so it allows us to choose who the patients, it allows us to work with the doctors that the patients want to choose. So it's a great setting.
That's great. All right. Well, thank you, Dr. Corsetti. I know you got to get backstage because he's going to be a big part of our event this evening, so stay tuned for more.